Good evening. I'm Mayor Ron Nirenberg with Bexar County Judge Nelson Wolff. We're joined tonight by Dr. Junda Wu, our medical director for Metro Health, and this is our COVID-19 update for the San Antonio community. Today we're reporting 396 new cases of COVID-19, so our 7-day moving average has also dropped to 400. Sadly, there are 17 new deaths to report this evening, and we have lost so many of our loved ones over the course of this pandemic, almost 4,600, so please continue to keep them and their loved ones in your prayers this evening. Over in our hospitals, there are 496 patients, so we're thankful to be below 500 for the first time in quite a while. There were 59 new admissions in the last 24 hours, 184 patients in the ICU, and 98 on ventilators with COVID-19. 82% of patients in area hospitals are unvaccinated. Again, get your vaccine. Stay out of the hospital. 20 patients tonight in the hospital are children. So on our vaccination report, Metro Health is continuing efforts to get people eligible, get people who are eligible to get vaccinated. And as of today, 1.5 million eligible residents in our region have been fully vaccinated, have had at least one dose of the vaccine, and 1,252,704 individuals are now fully vaccinated. We're making great progress to get people vaccinated, but it's important to remember that our immunocompromised neighbors and all children under 12 remain ineligible to receive a COVID-19 vaccine. So now that the virus is in a manageable position, it's at low levels, it's time to double down on mitigation measures and step up to get vaccinated. This is the opportunity that we have, according to our medical professionals, to issue a knockout punch to COVID-19 in our community. So this week we are also reporting a new number, the number of people who have received a booster shot of the COVID-19 vaccine in our community. 59,993 people have received their boosters since eligibility was announced on August 13th. So again, we're in good position because you've been working so hard, masking up in crowded indoor places. We've got the virus in the position to issue a knockout punch. Let's work on that together, get people who are eligible to be vaccinated to get their vaccine now. Let me turn it over to Judge Wolff.
Yeah, I like that term, knockout punch. There's only one way we're going to get it. Like I say, we still got about 25% of the population that's not fully vaccinated. And we don't want a winter surge. We had one last January, reached a high of 1,520 people in the hospital. We don't want to see that again. And the only way we can be assured not to get that winter surge is for people to get vaccinated. It's really important getting the booster, too. There was a pretty thorough study done that as time passes, the effectiveness of the Pfizer vaccine, as well as the others, will trail down. And while the Pfizer vaccine has kept us out of the hospital, it still doesn't mean that you cannot get sick because after about a 6-month period, it's gone down to like from 88% maybe to around 50%. So that booster shot is really important for you to get. That's a 6-month time frame in which to get it. So please go get the booster shot. Please get a vaccine if you have not had one before. And let's just, I hope people out there that refuse to get it, I hope they think what a danger they are to children, what a danger they are to the rest of the family, what a danger they are to friends and neighbors. So please do it. Please get your vaccination and have some regard for everybody else, because this is a non-vaccinated crisis we're facing. 80-some-odd% in the hospital unvaccinated, 90-some-odd% of the deaths unvaccinated. So please have some regard for the rest of us in this city.
Thank you, Judge. And as another reminder, the flu shot is also available at all Metro Health vaccine pop-up clinics, so please also get your flu shot while you stop by for your COVID-19 vaccine. We are entering flu season. We want to make sure that we're protecting everyone from flu as well. For those who have not received your second dose or your one dose of Johnson & Johnson vaccine, you are also eligible to receive a $100 HEB gift card. If you visit a Metro Health vaccine clinic, this incentive will be available until supplies last, and they are still available. So make sure you schedule that second dose appointment or your 1-dose Johnson & Johnson vaccine. Finally, the City of San Antonio operates 15 no-cost COVID testing sites. To find a testing location near you, you can go to our website, covid19.sanantonio.gov, or you can call our COVID hotline. That's 311 and hit option 8. Please wear a mask and get vaccinated. Do it for yourself, do it for your family, and do it for San Antonio. Let's get rid of COVID-19 once and for all, and you can help us do that by getting folks you know who are eligible to be vaccinated ASAP. With that, the Judge Wolf, myself, and the Dr. Wu are available for questions.
Dr. Piggyback about the incentive cards. You know, we hear people say that they're reluctant to get the second dose because they've heard about side effects. And first of all, not everybody has side effects, but also the usual whole sentence is, I don't want to miss work because of side effects. So not everybody has side effects, and also would $100 help? So please come to a Metro Health site for that second dose. That's all. Thanks.
Dr. Wu, there's a talk now that the Pfizer vaccine might be now available soon to those 5 and up. What questions should parents start preparing now for their pediatrician, and who should strongly consider this vaccine for that age group 5 and up?
Well, I think we're gonna watch the debate that happens in front of the FDA panel, and I think that might answer a lot of the parents' questions. I think parents probably are asking, is it safe, and how effective is it, right? So what we're going to get answers to those questions. Among the people who the mayor mentioned as not being vaccinated yet, and I don't think shaming or blaming people is going to get us out of this, but talking to people who your friends and family members who are not vaccinated, listening to what their concerns are. People just, have some reasonable concerns, and then helping them if they need practical support like transportation, that could help. I have lost my train of thought. The pediatric vaccines. The largest percentage, the largest number of people who are unvaccinated are, or maybe I may be saying it backward, but the people who are 12 to 29, that's where we need to work. That's where we've got people who are maybe like 50%, a little more than 50% of that population is vaccinated, but that's where we've got the most work to do.
And given what we know now about how COVID impacts younger children and those in that age group, 5 to 11, that would be impacted by this if it's approved, how does the data support the vaccination of those kids?
Well, I have not seen the data myself yet, so I'm going to not comment.
And is there any talk right now with some of the school districts in the county to launch some pop-up clinics maybe once the approval is finalized?
We're fielding some requests like that. I will say that vaccinating children, especially in the younger ages, it takes a higher level of expertise than vaccinating adults. And so we have, in our community, we don't have the same number of nurses and staff who have that level of expertise. We're really going to be looking for medical offices pediatricians who already do this all the time, to step up and hopefully be one of the major providers of the pediatric vaccines. And I think that's more comfortable for the parent and the child too.
Okay, I have one text question. This one's for the judge. In justice of the peace, Cyril Rodriguez's retirement letter, he said that he can no longer be a part of a system that lacks some basic accountability measures. He also mentions the practice of nepotism, spending taxpayer dollars on salaries for employees who don't appear for work. Do you have any reaction to his letter?
Well, a couple of things. Number one, throughout the pandemic, the there's been very few jury trials. Most things have been done over the internet. So I don't know that those allegations are true or not. There is the State Commission on Judicial Conduct. These two judges out there have been at each other's throat for quite some time, and they will have to make the final determination whether that's been violated or not. Remember, all judges are elected, and so they have to conform judicial conduct set by the state, and so I'm sure that they will be looking into it.
Okay, that's it. Thanks, y'all.
Thank you.